The ICF Training and Technical Assistance Team is honored to welcome you to this California Housing and Community Development training session offered through the Emergency Solutions Grant, Coronavirus Relief Consulting and Staffing Services contract. I'm Chris Pitcher from ICF, and I'll be hosting today's session. Today's training session is entitled Racial Equity and Data. This training session is special because it is part of our Racial Equity community workshop series. So we will be offering additional things, which I'll talk about at the end of this webinar today, for folks who want to learn more or be more involved in racial equity and data. It's my privilege to introduce today's first presenter, Alyssa Parrish. Alyssa.
Hi everyone, thank you for joining us today. We can go to the next slide. If you have a second, please feel free to add your name and pronouns and community into the chat. And we'll get through some other introductions here in a moment. Next slide, please. So quickly, we'll go through the agenda. Today we will do, again, welcome and introductions. We will go through our learning objectives and some grounding and engagement agreements. We are going to talk through some racial equity analysis frameworks, data quality and data collection issues, Stella P specifically, emergency shelter data, what might be missing, and then what's next. Next slide, please. So introducing ourselves this morning, afternoon for you as your facilitators. My name is Alyssa Parrish. I am a HUD TA provider with ICF. I use she, her pronouns, and I am Asian. I'm going to kick it over to Mary Frances.
Thanks, Alyssa. Super excited to be here in community with each of you today. I'm Mary Frances Kenyon. I also use she, her, hers pronouns. I identify as Black, and I am not here as a HUD TA provider today, so I'm super excited about that. All right, so we know that there's a large number of folks in the room today, but we want to do some level of engagement. So we've resorted once again to Slido. On your screen, you can actually join us right at slido.com and type in the number 867-430, or you can scan your QR code, and I am going to activate that poll right now. Our question for today is, who's here? Who's in the room? Who's attending the session? And we'll give you about 30 seconds to drop your answers in. And you can actually see the results as folks participate. All right, so we've got about 24 people that have participated thus far. It's looking like we've got some HMIS lead administrators in the room, COC leadership, a number of participating organizations, a sprinkle of funders. We've got some folks with lived expertise in the room, and a small percentage of folks that identify as other. So welcome to each of you. Keep participating. We will summarize all of the results and package them up with the rest of the materials. We're going to move forward in our presentation.
All right, thank you. So our learning objectives for today, we have some really great frameworks for understanding the data we have and also the data we don't have, with a focus on equity. So we'll explore some of those. Again, we're going to really interrogate and dig into Stella P, because it's a really great tool to really begin to understand your homeless response system. So we were able to get some Stella P data that is specific to the California COCs, and we're going to walk through some of that today, with more opportunities to dig into it further with smaller group sessions later on. I think we all know that the data in HMIS has varying degrees of data quality issues, and we really need to acknowledge those and know how to tease those apart from actual disparities and inequities. So we'll provide some suggestions on how to do that and encourage a comprehensive data quality management program to really continue addressing data quality issues while moving forward with using what we've got today. Emergency shelters specifically often serve as the first point of contact for people in our homeless response system experiencing homelessness in our communities. So we'll touch on the importance of them and concepts that are really key to effective emergency shelters. And then we often focus on what we have, what we do have, and the disparities and inequities that exist within the data that we have. But we also really need to begin to understand what we don't have, why those gaps exist, and then how we can get a better picture. Next slide, please. So for grounding, we really are acknowledging the issues we know that we have with the data. We know it's not perfect and it never will be, but we still need to start with what we have. We can't wait for perfection, and often starting to use the data that we do have is a motivator for folks to focus more clearly on data quality issues. So while acknowledging that we won't attain perfection, we also acknowledge that there are some data quality issues that are so big that they completely change our analysis. So we need to account for what we can account for and proactively address data qualities as much as possible. The first time I heard someone talk about interrogating our systems, I felt some kind of way. I think Mary Frances was actually in that conversation with me, and I was like, I'm not sure that I really like that term, interrogating, because I connect the term in my head to suspects or the carceral system. But the definition that I found for interrogate is to ask questions of someone or something closely, aggressively, or formally. And that's really what we're doing here. We aren't just accepting the system as it is or the data as it is. We are asking questions of it closely, aggressively, and formally. So I really pivoted to using this term of interrogating our systems as we move forward. And to really fully interrogate them, we can't just rely on the quantitative or the numbers. So the quantitative really tells us the what, but it doesn't tell us the why. So we really need to contextualize the numbers to understand why the numbers are saying what they're saying, which means that we are going to talk to people. We have to understand the local landscape, and we really have to ask questions and interrogate. Next slide, please. So some engagement expectations, I think we'll just name that virtual webinars can be difficult, especially like 90-minute ones. So we really appreciate you being here with us today. We expect that everyone is here and listening actively, engaging with us. We see that folks are introducing themselves in the chat. We would encourage you to continue to use that chat judiciously throughout this session and really ask questions, make comments, whatever makes sense for you to stay engaged. I definitely have to intentionally take steps to minimize distractions and multitasking in virtual settings. So we would encourage you to like shut down your email, turn your phone over, unless we're using the Slido. Would really like to share this space with you as if we were sitting together in a circle and sharing. And I think I'm kicking it over to Mary Frances to start on racial equity analysis frameworks.
Thank you, Alyssa. So we want to talk a little bit about the idea of using a racial equity analysis framework and walk through some steps to look at data equity a little bit more. So one of the things here is first identifying, right? This is one of the first steps. If we identify sources of bias at each step of the data life cycle, starting with funding and motivation for a project, all the way down to analysis and interpretation, along with communication, data ownership and control. It's really important to name each of those, each of the biases that may show their faces during that process in identifying, because that can impact the end result. Right. Alyssa and I were actually doing a training yesterday, and we were talking a little bit about inclusion and, you know, really being intentional about naming who is around the table. So similarly, like when you think about data and equity and how to use your data, how to understand, interpret, analyze it, it's important to pay attention to who's around the table performing the analysis, but also who is missing from the table? Like what perspectives? And we're talking beyond skin deep, right? Are there perspectives of people with lived experience or expertise? Are there, like, is the disability perspective represented? Is the LGBTQ perspective represented? What about the aging population perspective? So think more broadly. I think sometimes when we're talking about racial equity, because we are leading with race, we tend to think in terms of black and white. But this journey is really about expanding beyond that black and white binary and really focusing on a broader range of diverse perspectives that sort of reflect the communities in which you work. And that ties right into involvement. Authentic, meaningful interrogation of those data processes have to be inclusive. When you don't have the adequate perspectives around the table, our bias shows up. Not only does our bias show up, but the ways in which it can manifest through our data can be pretty glaring. So we want to move on to some of our racial equity theories of changes, right? Or theories of change, or our if-then statements. So we believe that if communities use a racial equity lens to examine the disproportionality in homelessness, housing instability, then communities will learn how to reduce systemic racism in the overall homeless response system, using more culturally responsive data evaluation to identify disproportionate unmet housing and service needs. Shameless plug here, not so shameless. Also want to name this really early on. I know that we're talking about data today, and when we talk about data, we tend to think in terms of numbers. Alyssa will run all of this down, but I want to plant the seeds very early on in our presentation today that when we are talking about data for this purpose, we're not just talking about the numbers, we're also talking about the stories behind the numbers. So the qualitative data. Under no circumstance should a community just be looking at the raw data and saying like, hey, we're doing really great, because that might not be the case. Numbers don't always paint a full picture, but more to come on that later. Our other theory of change here is that if communities participate in supported discussions and learning opportunities with the HMIS data users, people with lived experience, and COC partners on centering equity during the data collection, analysis, and interpretation phases, then those communities will then understand what necessary skills, resources, decision-making entities, and data structures are actually needed to work towards a more racially equitable homeless response system. And that in turn results in community-led, data-informed solutions. I think I'm kicking it back over to you, Alyssa. I'm not kicking it back over to Alyssa. I am going to talk about the keys of an effective racial equity analysis, which is great because we just did this yesterday. But thinking through the elements that are needed to be successful when you're conducting a racial equity analysis, and this is going to start feeling a little repetitive, but I can't emphasize enough how when you're going through the identification of stakeholders process, making sure that you have that diverse range of voices and perspectives around the table. And that may mean that you have to meet some people where they are, literally meet them where they are. Prime example, we were doing some work on an East Coast community, and we had this like big meeting, and we pulled out all the bells and whistles for this meeting, but we had it in a government building and nobody showed up. And we were really disappointed. And there was one young woman who approached us and said, you know, if you try having this meeting in the community, more of the Hispanic population is going to come out. They don't feel safe because there are some tensions around ICE engagement in this country right now. So what we did, because we wanted to reach that population specifically as they were somewhat underrepresented in our data, we actually had to have a meeting in community locations. And that shifted our ability to effectively engage stakeholders, which is one of those keys of being effective listed here. So that's what I mean by meeting people where they are. You want to identify and document inequities and Alyssa may talk about this as well. I think we've spent a lot of time talking about overrepresentation and disproportionality, but we often miss the mark on who is potentially underrepresented. We know that there are some pan-ethnic umbrellas out there that kind of serve as a catch-all, specifically for Asian Americans, Pacific Islanders, and quite frankly, under the ethnicity umbrella of our Latinx or Hispanic folks. This misses like that rich cultural context, but it also can hide some really alarming disparities that we just don't know about because it might be more culturally specific than those, you know, sort of standard 5 race and standard 2 ethnicities that we have collected data around. So be sure to pay attention not just to who's overrepresented, but also take a deeper dive on who might be underrepresented. So from there, you want to look at the local, cultural, and historical context. And there's a number of ways that you can do this. You can do this through doing some of that qualitative data collection, but you can also use Google. You can look at redlining maps to see who's been, what segments of the community were historically redlined and segregated and placed into areas that grew further into depression and being distressed or blighted communities. Those are some of the words that we commonly hear in our field. You can also look at whose land you might have been on. This is native land, right? All throughout the country. There were hundreds of tribal nations that lived on this land prior to colonization and prior to their erasure of their culture and history. Those are great clues because those historical realities lead us right on into present day realities. Make sure you're clear on your purpose. Like why are you doing this? What's your North Star? Where are you going with this information? Consider adverse impact, right? Consider any harm that could be caused. We've caused enough harm as practitioners, as homeless service providers, even with the best of intent. I certainly have. I'm raising my hand and saying there are some things that I did as a case manager 10 years ago that I am not proud of today. And I'm really disappointed, but I've taken those moments as teachable moments and made sure that I don't cause harm moving forward. So make sure you're looking at the what ifs and really focusing on advancing equitable impacts. And I think sometimes we view achieving racial equity or advancing racial equity as something that is really ginormous and impossible. But there are some really smart and practical ways that if you continue on this journey with our team, we will be able to help you in achieving some of those practical applications. Example, look at alternatives or improvements. I'm just going to say this, there are a number of communities, including some of you in this room today, that are working towards change and that are kind of testing out your own theories that are specific to your communities. There's no more powerful example than that peer-to-peer learning. So if you are doing something amazing in your community, if you're trying something new to advance equitable solutions in your system, please share it. And even if you make mistakes along the way, because this is a very iterative process, it's also, it's not a sprint, it's a marathon. Those are lessons to be learned, lessons that you can share with others so that they don't have to repeat those mistakes, right? As long as you course correct and as long as you continue to iterate until we get it right. Then you want to think about viability and sustainability. Are the solutions going to be practical? Are they going to be able to help you achieve those indicators of success, which is sort of the last point. Like you have your North Star, which is your like vision, but how are you going to get to that North Star? What is going to tell you that you're on the right track? Now I'm turning it over to Alyssa.
You are. Thank you, Mary. So I was looking at the slide earlier and we should have replaced it with that data one with the Legos. And I don't know if folks have seen that one, but just thinking through data as a starting point, it's really a great way to begin understanding the disparities that exist within your system, but it's the starting point, right? It's not the end point. We have a screenshot here of targeted universalism, which we'll go over next. But that is really one of many of a great framework within which you can analyze your data to really ensure that racial equity is prioritized. I think using a targeted universalism approach is simple, it's outcome oriented, and it rejects a blanket universal strategy and builds from a shared goal or universal aspiration. This really looks to meet the specific needs of each member of the community, identifying the specific barriers to attaining the universal goal for each group within those. Again, we'll dig more into that framework in a minute. HMIS, I think, as many of us know, is a great set of data specific to your homeless response system, but there are other data sets that may supplement the data that's in your HMIS. We know that it is not the whole picture. And when we look at the people that we're serving, we aren't just serving their homeless experience, we're serving a whole human. So there might be other data sets available to you to look at to create a better, more comprehensive picture of your homeless response system and the people you're serving. So things like eviction and other housing related data, school data, hospital data, the carceral system data, other data sets. I think also looking at, and this is something that I will own that I have not been good at over the years when I was in an HMIS lead role, about who is involved in analyzing and interrogating that data. Are those persons that the data represents involved in analyzing and really understanding it, interrogating it? And the qualitative piece, again, which Mary mentioned earlier, around like, we are talking about the numbers and the why, which is the quantitative, but we also need to balance that with the qualitative and qualitative information. So that story behind the data. Both are really important and both matter. I think we can go on to the next slide. We'll walk through the targeted universalism framework. This is my 3-minute elevator pitch if you're taking a really long elevator ride to understand targeted universalism. There are 5 steps in a targeted universalism framework, and I think that we have some links at the end of this presentation that link to a targeted universalism primer, and then a 3-minute video that really goes through this process. So the first step is really to establish a universal goal. I think since we are in the work of addressing and ending homelessness, we'll say that our universal goal is to decrease the length of time people experience homelessness in our system, right? That is something that we all want to do. The second step is really to assess performance relative to that goal. So we're measuring how the overall population fares relative to our universal goal. So for our example, this would be our system performance measure that really looks at the length of time clients experience homelessness in our system. So let's say that for our specific community, the average length of time for our overall population, so everyone served in our HMIS over a specific period of time, is 100 days. The third step is to really identify different performance between the goal and the overall population. So we measure the performance of population segments or subgroups relative back to that universal goal. This step isn't comparing subgroups to each other. It's looking at how subgroups are performing relative back to that universal goal. So we're not looking at comparing how long Black African-American folks are spending in our system versus white folks or Asian folks or Hispanic Latinx folks. We're looking at how all of them, how long each of those subpopulations are experiencing homelessness back relative to our overall population of 100 days. So while the overall average length of time people experience homelessness in our system is 100 days, we'll say in our example, that the average length of time Alaska Native American Indian people experience homelessness in our system is 150 days. So the fourth step is to really assess and understand structures. So we're looking to understand how structures and other factors support or impede various subgroups' progress toward that universal goal. So really, what is making some subgroups perform better relative to the universal goal? And also what is making some subgroups perform worse? again, relative back to that universal goal. So in our example, one of the impediments could be credit score requirements for landlord applications when folks go to fill out a landlord or an application for a rental unit. So we can learn that the local tribal nation has a really great banking and lending system for their tribal nation members, but that activity isn't captured. I'm sorry, hold on. I apologize. I have children home today. This is pandemic life. Sorry. So we could say that the local tribal nation has a really great banking and lending system for their tribal nation members, but that activity is not captured in the official credit scores that are pulled for landlord applications. So the fifth step is to develop and implement targeted strategies. So we implement targeted strategies so that everyone can achieve the universal goal based upon their needs and circumstances. So in our example, we could work with landlords to accept other documentation of credit beyond the official credit scores, or we could work with landlords to come up with alternative methods altogether for screening potential tenants. We could also work with people experiencing homelessness and understanding what comprises their credit score and try and create strategies for addressing common issues. But I think in this scenario, we would really want to try and work with like the systemic issues, not necessarily like the people being impacted by those systemic issues. Next slide, please. I appreciate your grace and patience. I think you probably have more than I do at this point. It has been a very long week. Racial equity impact analyses or assessments really examine how different groups may be affected by a proposed action or decision. These can really help communities minimize the unanticipated adverse consequences of any strategies that are implemented. I think that the persistence of deep racial disparities and inequities across our society is really evidence of institutional racism. And when racial equity is not consciously addressed, when we aren't being actively anti-racist, racial inequity is often unconsciously replicated. So racial equity impact assessments are best done during the decision-making process prior to operationalizing something. The process really includes identifying stakeholders, and again, really, as Mary said earlier, intentionally seeking out diverse and inclusive perspectives. It's analyzing the data available, both quantitative and qualitative, to really identify what disparities exist. That story behind the data really examines the why. Why are these racial inequities produced and perpetuated? Why did the inequities arise? Do the proposed actions or decisions address those root causes? Then we have strategies that include clarifying the purpose. What does the proposed action or decision seek to accomplish? Will it reduce those disparities? We intentionally consider adverse impacts. So who would negatively be impacted by this? And how could we prevent or minimize those impacts? And then we also intentionally consider equitable and positive impacts. How do those proposed actions or decisions reduce disparities and advance equity? Which specific groups will benefit? Are there ways to maximize equity? To evaluate, we really need to identify success indicators and benchmarks. So how will those be documented and evaluated? And then we refine over time, right? So are there better ways to reduce disparities and advance equities? What are we learning from implementation? How can we pivot to do better? I think we are going to go to the next slide. And we're going to spend some time on data quality and data collection impacts. These can have significant implications on your data analysis. So we want to address what we can and continue to improve over time. So I think we have our next slide I'll pull next. So I'm going to kick it over to Mary.
We do. Thanks, Alyssa. And the poll is now active. So again, join us at slido.com and you can pop in 867-430, or you can whip out your smartphone and scan in the QR code, which will take you directly there. Our question for you is around data quality. What is your biggest data quality issue? Timeliness is dominating at the moment. I can relate. So we still got some folks voting, but timeliness leads the charge, followed by accuracy and then completeness. Actually excited to see that HMIS coverage is not that large on the map. That's a good deal. All right, so we've got about 72 voters. Feel free to keep on chugging away on that poll. I'll leave it open for another moment, but we'll get back to the content.
So it sounds like all of you have a good sense of what the data quality components are, but we'll just run through them really quickly. So completeness, how many data elements that are required to be in your HMIS are actually there for any given client. Timeliness, how quickly is the data entered into HMIS after it's collected from people. Accuracy can be really difficult to measure. I think we all are aware of this, but how much is the data entered into your system a reflection of the individual's reality? Consistency, so is the way in which the data is interpreted at agency A the same way it's interpreted at agency B? Are we using the same common terms and definitions? So when I say this is a destination to a permanent housing situation, does that mean the same thing to me, permanent housing destination, as it does to you? And then coverage of the universe of projects that serve people experiencing homelessness. How many are actually entering that client level data into HMIS? So there is a really great resource on the HUD Exchange. I don't know if we can get that. I didn't get that link quickly, but maybe someone can grab it for me, on the HMIS Lead series of a comprehensive data quality management program that includes a data quality plan that addresses all of these pieces around data quality, but also thinks through incentives and enforcements, what the reporting looks like for that, and enforceable agreements that really lays out specific roles and responsibilities of everyone who would be involved in this process. An example of accuracy for me that really impacted a data quality analysis that I was doing specifically related to equity was in Southern Nevada. So I was doing a data quality analysis. I'd gotten a data set from the system and was starting to do some analysis and interrogation. And I had been really used to, as an HMIS lead in my previous life, being able to account for some data quality accuracy issues before I pulled the data out. And that wasn't what I could do with this specific data set. So I'd gotten this data set and had started to analyze it, and something was looking a little bit off. And when I went back into the data set, realized that there was one specific approximate date homelessness started that had been dated, like miskeyed, right? It was dated for like 3021 or something. But because that one was in there, it was throwing off the entire data analysis. So just being able to look for what you can and account for what you can, whether it is like as you're pulling the data out of your system or once you have it out before you actually start to interrogate it and understand it. We're not going to be able to account for everything, but some of those things that are obvious, like a 3021 date, can be really easy to catch and something that can, again, significantly change your analysis if it's not accounted for. Next slide, please. So the timeliness piece, which I think Mary flagged as like on the Slido, seems to be the biggest issue, data quality issue. I think the longer it takes to enter data into HMIS after it's collected from the person, the more room for error. We could lose the paper form, we could forget what was said. I mean, we could forget context. So the longer it takes, the more room for error. It can also impact how quickly your system can move to support the people experiencing homelessness. Lengths of time can really be impacted by not exiting folks out of projects in HMIS in a timely manner. So this is specifically the case around like night-by-night shelters, street outreach projects, coordinated entry. I know we often answer questions around like, if somebody disappears from street outreach and they don't ever come back, what does that exit look like? What is that like length of time for them not having shown back up? And what does their exit date ultimately look like? I think unknown exit destinations are big issues with shelters, street outreach, and coordinated entry, again, because people just tend to like leave and they don't have any reason to tell us why they're leaving, because they might not even know why they're leaving. And so those unknown exit destinations can be a really big pain point for like large mass shelters and some of those street outreach and coordinated entry projects. So thinking through that, like what policies could be changed to improve upon this, even if it's a small percentage of destinations that can be collected. Even if it's like, you know, you have a 150 bed shelter and of those, you're able to get 5 folks to tell you where they're going. That's 5 more than you had yesterday. The accuracy of the data elements used to calculate chronic homeless status. So I mentioned the example about approximate date homelessness started, not right now, but prior living situation, length of time, approximate date homelessness started, the number of times experiencing homelessness in the last 3 years, and the number of months experiencing homelessness in the last 3 years. The accuracy of that kind of data set collection, the 3.917, that is a big pain point because it is hard to account for, if not impossible to account for, all the different ways in which that information can be inaccurate between and among each other. On the other side, the Census Bureau categories, which I think Mary mentioned earlier, we've got 5, and American Indian and Alaska Native are rolled into 1, and having supported a state that was like predominantly one of those, like it is difficult to be able to do any kind of real on the ground analysis with that specific race category. So the Census Bureau categories for race really groups folks together under, again, Mary mentioned this earlier too, the pan-ethnic umbrellas, which can help counteract like small ends or small universes, but it can also mask really important disparities between and among various subpopulations within a given race category, like Asian, like Hispanic. Again, like American Indian, Alaska Native, or Indigenous includes a lot of different tribal nations, sovereign nations that are their own independent entities. So Alaska had a custom data element for Alaska Native regional corporations. So while we had to use the race category of Alaska Native, American Indian, Alaska Native, they then had an additional data element in HMIS that accounted for the 13 identified Native regional corporations. And even within that, there were like even more villages, which we didn't have as a data point in HMIS, but just thinking through what level of detail is needed in your system to be able to do intentional interrogation at the local level. I think I'm kicking it over to Mary.
Yep, thanks, Alyssa. So want to spend a little bit of time talking about data collection and empower analysis. And as we think through achieving greater equity in data collection itself, definitely want to do sampling equitably, but within existing processes and using existing resources so that we don't create an additional burden. We already know that folks experiencing homelessness, housing instability already have to navigate different systems that may or may not interface with one another in a way that makes life easier for them. So we definitely don't want to increase the burden. There, with good reason, we want to make sure that we're balancing privacy concerns, but specifically for Black folks, Indigenous folks, really all people of color, because we know that there has been historical harm that has been caused, not just with data from like a quantitative perspective, but just with their personal information in general. And there are, particularly in the biomedical space, in the research space, in the eugenics space, people have suffered abuse, some of it physical harm, but also some of it more sacred harm, not being provided the opportunity to consent. So just make sure that we are creating a balance of data collection and recognizing that there has been historical harm that has been caused to specific people in our country, and that they have a reason to be concerned about privacy. So this one is a big one. Really powerful way to advance equity and data collection, but it can be difficult. Terminology. We are historically a field that uses a lot of acronyms. We've got HMIS, y'all have HDIS, and I'm sure that your provider base sometimes uses acronyms. And then we talk about our funding streams like ESG funding, COC funding. Data is that same way too. We talk about UDEs or universal data elements, and all of these things that we, as folks that are working on the side of the field, have come to know, and they're widely accepted in our space. But think about someone who really has never experienced data from our perspective. Think about creating language that is more easily understood. Think layman's terms. Just make sure that the data terminology is becoming more accessible. And I'm sure Alyssa has some ideas on that she can share if you have questions around that. Also, data reliability. Don't discredit small sample sizes, right? Those should be taken into consideration as well. Just because the sample size is smaller doesn't discredit that. Also, eliminate assumptions with the secondhand or administrative data. And then you really want to set equity standards for how and when and where data is extracted. And I would even go as far to say as who's doing the extraction, like what group of people or what person is doing the extraction. Make sure that you have checks and balances in place. And you also want to provide opportunities to learn why people might be opting out of providing data. And then you can use that, going back to the first and the second bullet, to really inform those strategies, right? You want to minimize harm. You also want to minimize the inequities. And then when we talk about power analysis, one of the greatest assets of achieving racial equity is about balancing power, right? We know that, for example, when I was a program director for shelter, rapid rehousing projects, I held a lot of power, right? Because I was a decision maker. A part of advancing racial equity is by really interrogating the power balances or imbalances, rather, because what we find is a lot of communities have this really deep power imbalance, and there are just a small number of people that really and truly hold power. And it shouldn't be that way, right? We want to be able to co-develop and co-create and make joint decisions. So there's some steps that you can take to do some power shifting. Simply acknowledging the value and inclusivity of decentralized power. I like to think that Alyssa and we're on a team. We have a pretty big team. It's like a team of 20. And a lot of times, like we have these deep conversations and we talk about strategies and we talk about power and we talk about how that shows up in our space. And I don't think we're perfect, but we have tried, we're striving to work towards a more collective decision-making process and more collective decision-making body, so that not just one person on our team holds all of the nuggets of power out there. So in order to interrogate who has power, you got to find out who holds the power. And then you want to determine what that power is used to accomplish, right? You explore a little bit further where the imbalances are showing up, where it's unequal, and what's driving that. What is driving the factors behind the inequitable power structures? And then you implement a shared power structure. It sounds simple. It's really hard. A lot of people like to hoard power. That's a thing that happens, so I want to name it. And this takes time. It takes intentionality. But when you are developing a shared power structure, this is going to be something that probably requires a little bit of change management, unless you're the type of like leader, if you're in a position of leadership that says, you know what, I want to share power with you. I want to center the folks that are going to be most impacted by the decisions that we make. But otherwise, it can be difficult to achieve power imbalances, but it doesn't mean we don't do it, because it's hard work. So looking for data sources, right? We want to know what data do I actually need? So we know we've got a lot of readily accessible data. And I'm going to preface this by saying we know that the PIC count is not a perfect methodology. We understand that. We know that it's a pain and a heavy lift for communities throughout year over year that are doing point in time counts. But it's data, and it's there, and it follows a methodology. It's publicly available. So use it to your advantage. And I don't think we're saying that this is the end all be all. It's just your starting point, right? And as you develop more robust data collection policies, quick example of that is with like the HMIS system that we used to use, like we customize for elements like language. So we used to collect that as a data element. And that's a lot of languages to capture, but we used to capture language. We used to capture country of origin. And it was really helpful, right? It helped inform things like our limited English proficiency policy. It helped us inform like what type of interpreters we needed to have based on what the dominant language need was. So just a plug for you to consider that your PIC count data is not your endpoint, it's your start point. You can use the American Community Survey data to use as a comparison point. Also not perfect. It's coming from, census, like the 5-year mark of the census records, but it's available, and it has your demographics by race and ethnicity and age and gender. It's also a good starting point. There's not going to be a data set in this world that is perfect, but you have some readily available resources at your fingertips. So that's going to get you started on who's overrepresented and who you might need to pay a little closer attention to because they might be underrepresented. If you're looking for who is being served by your system and you want to compare it to who is not, look at your annual HMIS data. It would be great if communities are able to run like a quarterly report card data. That's something we used to do in one of my communities where we're looking at data as a COC on a quarterly basis. We're looking at the number served, we're looking at exits to permanent housing, pulling down some of that, the relevant system performance measure data just to inform like who's coming in, who's our inflow, who's our outflow, are we creating any disparities along the way? And there are other data sources from HMIS. We've got LSA, we've got Stella, all this good data is available, but also coordinated entry prioritization list. Can you check out that data? That's going to tell you who's being served and who might not be served adequately. And I just mentioned some of the like how behind how you're serving people. Looking at length of stay. Is there a group of folks, like is your aging population staying in shelter disproportionately longer, in comparison to a younger age range? Exits to permanent housing. Who's making it out successfully? How quickly are they making it out? And do some deeper dives. Like if they are not making it out, why is that? Have you talked to them? Have you been able to pair some of that qualitative data to go with the numbers that you're seeing? And then, of course, returns to homelessness. This does feel very HUD-ish, but I will say this. If you go in and take a look at your data to see who's returning to homelessness, it's great if you're exiting people quickly to homelessness, but if they're returning equally as quickly, that's a problem. And there's a fundamental breakdown somewhere in your system. And this data can help answer some, not all of the the reasons behind this, but those are just some key elements that you do want to take a look at. So who do you need, right? How do you define community partners? How do you help elevate the voices of people with lived experience? How do you make sure that you are adequately representing the community that you serve? Is it representative? Well, there's a number of things that you can do. Some of it, and congratulations, I don't think we've talked to you since the COC program NOFO closed, but congratulations to each of you that had to participate in that annual process after last year's COVID-related break. But as a part of that process, HUD is asking you to do this stuff anyways, so it shouldn't be new. There are parts of the NOFO where you've got to talk about what your outreach is looking like. These bullets identify specific groups and people that you can reach out to. You want to focus on culturally specific trusted organizations. Some listed here, and this is not fully inclusive. But again, Google can be your greatest friend. And some of these organizations are, national umbrella organizations that can connect you to more locally specific organizations for your communities. But Urban League, NAACP, Native Americans in Philanthropy, Asian Americans, Pacific Islanders in Philanthropy, National Latin Network, National Association for Latino Community Asset Builders, just to name a few. But also think about local leaders from those organizations. Think about your faith-based partners. Think about, other social service agencies, community-based organizations that might be able to help widen your bench, but also diversify your perspective. Tap into mailing lists, ask to make regular notices on website, ask to partner on events. You really want to establish this type of collaboration to strengthen the overall response system. And I think what you'll find as well is that when you start to make connections like this, you're going to have the opportunity to influence other social programs. One of the things that, and I think we've got a little bit of time to share this, so I'm going to go ahead and share this. But one of the things that we did in a community before was through surveys, just sending regular consumer surveys on a quarterly basis to our emergency shelter residents. The thing that came up, sad to say this, but for a year, 2 years, 3 years maybe, was the quality of food. They hated the food. They're like, we're not eating it. The food is trash. It's garbage. We hate it. And that was a reoccurring theme in our qualitative data. So we looked under the hood a little bit, pulled up the contract. It was one of those legacy government contracts that was just on auto renewal, needed to have been competitive. We bid, but wasn't. And we found that there was a company who uses the private prison industry to actually profit, right? So this was an Airmark, but they were actually having inmates in our local detention center prepare the food that not only the inmates were eating, but they were sending it to our emergency shelters for single adults. And so we had to work for about 2 years to make this happen, but we got rid of them. And it did two things. One, it created an opportunity for a local nonprofit that was serving returning citizens and folks that were in recovery or practicing sobriety, an opportunity to learn the food services industry. But it also it took away the use of, private prison for profit. And the end result is that our qualitative data sure perked up after, a couple of survey cycles. But the human experience was the most important. We were able to impact the human experience for people experiencing homelessness because they now had access to quality, fresh local produce wherever, whenever it was available seasonally. But they also had an opportunity to, receive services and goods from an organization that was helping people that had likely been negatively impacted or harmed by, the carceral arms of the justice system. So wanted to share that because what you do when you're collaborating with other organizations and other sectors doesn't only impact our folks who are experiencing homelessness, but it also impacts other folks and their ability to be successful. So speaking of qualitative data, talking about that human experience, and I shared this earlier, if you are only using numbers to perform your analysis, it's going to be very limited. I think there's 3 lies, damn lies, and statistics. I don't know who I should contribute that quote to, but you can manipulate numbers, right? If you don't have the story behind the numbers, you're not getting your full picture. And this can, while the quantitative data can highlight the inequity, it doesn't explain why it exists. So you want to get the person's experience of your system and projects, and I just gave you an example of what that looks like and why it matters and how you can affect change. But you also want to be informed, like what are folks saying they need, right? What do they need to end their homelessness? I think we have to rethink who we call an expert. And although each of us around this table are experts, the folks that have the lived experience are the experts in their lives. You also want to see if the responses differ by race and ethnicity, gender, disability, age, all of those different sort of protected class factors to make sure that you are moving forward with like a fully informed picture of where the who, the what, the why, the where, so that you can start figuring out how to make some changes. I think this is you, Alyssa. Maybe it's not. Monitoring data. So this is having to deal with the data life cycle. One of the examples I used a couple of minutes ago was around like looking at data on a quarterly basis. This was a really helpful, really powerful tool, not just because it helps with those different elements that are required of you for HMIS, the timeliness, your sort of data quality standards, completeness, accuracy, all of those things. But it really puts you in touch with what's happening quarter to quarter. Some folks may have the capacity to review their data on a monthly basis, which would be amazing. But at a minimum, go for quarterly, right? You don't want to wait for annual due dates to start reviewing your data and start figuring out what's happening. This isn't something that is like a one and done. If you don't continue to review it on an ongoing basis, you won't know if you're affecting changes, if you are like backsliding. There are some great examples of equity data, publicly available equity dashboards out there. Take a look at them. Start linking. I mean, with Tableau and just different data visualization tools, there are so many options for you to make this information public. You can help build, I won't say build a business case, but you can help bring attention to why you're focusing on this issue, right? And you can do that through your data. Equity goals in the funding processes and contracts. This has been a great tool. We've used it in many communities, particularly with all of the inflow of CARES and ARP funding. But you can actually incorporate equity goals into your procurement process. That can result in newer organizations, so those non-legacy, non-traditional homeless providers coming to the table. And while we don't want to take away from our existing providers, we do want to create room and space for other providers that are culturally specific to have a seat at the table. Make sure you're requiring reporting on equity goals in your contract reporting. And then when something new shows up in your data, make sure that you're pivoting and you continue this cycle in and out. That's definitely Alyssa.
This is me, and we're running a little bit behind, so I'm going to try and get through this quickly. But Stella P, I'm hoping that this pathways graphic looks familiar to you. But we'll go to the next slide. I think so. The LSA, which is the longitudinal systems analysis, we are in LSA season right now, if you will. The data cleanup process and the LSA itself is submitted through HGX 2.0. The LSA is then what is used to populate Stella P or Stella Performance, and it includes specific projects while excluding others. So I think there's actually, can we go to the next slide, Mary? There's actually, so it shows us which project types are included in Stella, and there's an error on this one. Stella P and the LSA does not include the other permanent housing project types. So that should be in the does not include. That is my error, actually. But it does include emergency shelter, safe haven, transitional housing, rapid rehousing, and permanent supportive housing. The LSA does not include homelessness prevention, street outreach, coordinated entry, services only, and the other permanent housing. So again, the LSA is what is then used to populate Stella P or Stella Performance. So next slide, Stella. The SPMs really look at data. So the system performance measures look at data at the individual client level. Stella and the LSA looks at the data at the household level. So it does show demographics for people in households served by various projects. And it really does look at those three big performance measures. I think that Mary mentioned earlier. So length of time experience in homelessness, exits to permanent destinations, and return to homelessness, again, at the household level. So this is different from system performance measures. So for example, if there is a household of 5 people and one of those persons returns to homelessness after exiting, the system performance measures will capture that, but Stella would not. So Stella also looks at different pathways households use to navigate through the system and system mapping. So that graphic at the beginning is a system mapping or graphic that shows kind of the different ways in which people are the different ways in which households are accessing the system, and to show how the system is functioning. So it really does look at the data in various ways. There's also a race and ethnicity guide on the Stella LSA landing page on the HUD Exchange to specifically use Stella P to look at the data by race and ethnicity and to look at disparities. It also looks at other important subpopulations like the adult-only households that are 55 and older, our adult and child parenting youth, the adult and child households with 3 and more children, and some others. So really quickly, next slide on the California specific data, there is a dashboard that was created based on the data that we received from different COCs around Stella data. I think these slides will be provided to folks after the session today. So that is linked, that dashboard is linked on the slide. There were different COCs that showed different disparities or issues to really start to interrogate. And we'll dig into these more during the small groups offered again at a later time, really operationalizing this, understanding it, going through it at that local level. But there were some common trends across all of the COCs related to this data. So Black African-American households accessed PSH and other services at a lesser rate than the overall percentage of them experiencing homelessness. They were also exiting to permanent housing destinations at higher rates. So that could be rapid rehousing rentals, staying with family friends permanently. So they were accessing some parts of our system less while exiting to permanent housing destinations at higher rates. So really at the local level, we need to interrogate this to really understand why these trends exist. Alternatively, white non-Hispanic households access PSH at a much higher rate than the overall percentage of them experiencing homelessness. By the same token, white Hispanic households access PSH at a much lower rate And again, we would want to interrogate at the local level while these were common trends across the different COCs to get at the qualitative local context of understanding the why. We'd really want to work with communities to understand that. So next slide, please. And I think I'm kicking it back over to Mary.
Thanks, Alyssa. So when thinking about emergency shelter, you want to look at what it looks like in its current state. So who's it serving? Who's it not serving? How are people accessing emergency shelter? Is there a single point of entry? Is there like a centralized access system? Or does it vary from provider to provider? Or are there multiple access points? What eligibility requirements are in place? And how is your emergency shelter connected to other parts of the homeless response system? What are supports looking like? And when you think about the framework for emergency shelter, you want to think about those requirements for entry into shelter being low barrier or very limited barrier. So sobriety is prohibitive, chores and work are prohibitive, background checks, again, things that I'm ashamed of from the past, used to do warrant checks in the jurisdiction I worked in many years ago. Identification, that's always a hot topic, but these create additional layers of barriers. So you really want to shift to low barrier because the focus is not to fix all of those things. The focus is to end the immediate housing crisis. When you're thinking about how to prioritize, you want to really focus on who needs shelter most based on vulnerability. We're going to put a pin in that because I know there might be questions that pop up around like assessment tool. And we're not diving into that today, but we know that there are issues with the assessment and prioritization process. I would say focus more on full coordinated entry process as opposed to just the assessment tool driving decision to prioritize. In terms of equity, if you are seeing that data is consistently showing that folks of color aren't accessing emergency shelter in the same, proportionality to others that experience homelessness, you need to be looking into why that is. So for what's missing, right? Who isn't accessing? So who isn't accessing? Who's underrepresented? And not to keep picking on like Asian American, Native Hawaiian, Pacific Islanders, but generally speaking, there are challenges with seeing exactly who's experiencing disparate outcomes because of that homogenizing that we do by way of identifying folks in the race and ethnicity categories. So who's overrepresented in experiencing homelessness, but underrepresented in accessing the services? And who are we serving, but we don't necessarily have good data on them. So street outreach typically comes up. It's difficult to track down folks that are experiencing unsheltered homelessness if they are, highly mobile or transient. So who is it that we need to talk to better understand? And then what other data is available to better understand? One of the things that we did in our system was collaborate more closely with the police department, and we asked them to collect data. There are a number of jurisdictions, some use HMIS with law enforcement, some do not, but there are options there to partner, particularly around street outreach. And when it comes to other data sources, think intersectionality. Think about any of these data sets that you're already reviewing, any other data sets that you want to look at and what other data might be helpful. There is such a wealth of information, and I'm going to ask Alyssa to piggyback on this piece, but child welfare. Child welfare is doing a lot of work in racial equity. Same with education, same with, the criminal justice system, same with housing, same with evictions. There is so much more data out there now than there was, say, 5-10 years ago. Reach across the aisle because you might find that your population that's overrepresented in homelessness might be impacted by one of these other sectors. Alyssa, you want to talk about social determinants of health and ACEs real quick?
I can. I think it's thinking through, to your point, Mary, like there's a lot of data out there. So, and some of this we can collect about these various things directly in our system, but they're in our system being our HMIS, but we can also look at how we can use those data sets outside of HMIS to really understand the people that we're serving. Social determinants of health specifically is something that I've really focused on over the last several months, and more so those adverse childhood experiences, as we're looking at, and we'll have a session that will be dedicated specifically to coordinated entry prioritization and determining how to measure vulnerability at the local level. But I think that there is interrogation that can happen at the local level around social determinants of health and adverse childhood experiences, and whether or not those can and should be incorporated into your local processes around coordinated entry and prioritization and determining vulnerability. So more to come on that, I think. Yes. So the data in HMIS isn't perfect. It never will be, right? So, but we use what we have. We let it help us get better. The quantitative, or the what or how is our system performing by the numbers, really, again, we've said this over and over today, but really must be balanced with the qualitative, or the why. So understanding why our system is performing the way it is. Disparities may exist in both who is served or accessing our homeless response system, as well as how they are served. So I think we are seeing that a little bit, or the beginnings of that, in the Stella P data. And again, we aren't looking at the performance of people, but the performance of our system in serving the people. We also really need to look at who is at the table when decisions are made and when data is interrogated. So who isn't included, who needs to be included? Does the table just need to be completely rebuilt? We can't just invite folks who have no power. We really need to meaningfully engage them in the process. And this really does create a broader perspective and understanding of the data, right? Like, again, I think I said this in the beginning, like I will own that we were not intentional about having a diverse perspective when we started to analyze and really interrogate the data that we had. And so my perspective is limited because I can only see one side based on my experiences, my life, and like what I know to look for in the data. Partnering that with people with lived experience, trusted members of minoritized communities, like those different perspectives will round out our interrogation so that it's not just based on like the data perspective. Next slide, please. I think we would be pretty remiss if we didn't mention HDIS, or the Homeless Data Integration System, during a California specific training that includes data specifically around homelessness. So COCs have access to their own data and HDIS to dig further into racial disparities. They also have some stories specifically around racial disparities. BCSH they were hosting monthly HDIS Academy sessions around how to use HDIS in a variety of ways. They've paused that until the new year, knowing that there are holidays to navigate through over the next couple months. I think we have the link to the BCSH or the HDIS landing page that we can provide to folks if you don't have that. So just wanted to make sure to mention that. And next slide. So our framework for moving forward is really a strategy, an overall strategy that is designed to pursue equity. So who holds power and how can this be more equitable, diverse, and inclusive? We have to include the voices of people with lived experience. We also need to keep the work centered on community goals and ensure that definitions for what those goals are shared across the community. We want to set short-term goals, not just long-term plans that allow for pivoting and updating as needed. We didn't dig really into housing problem solving today. We probably can incorporate that more into like our coordinated entry specific session. Housing problem solving is not a separate project type within an organization or within your HMIS. It's really a philosophy that can be embedded in your entire homeless response system, similar to Housing First. So this is really flexible conversations with people to identify safer alternatives and really create pathways out of their crisis. So we can dig more into that, like I said, during coordinated entry. Data means both the quantitative and the qualitative, as we've said several times today. It also means looking at the performance of the system, not just who is accessing your system. Qualitative includes talking with people, understanding how the process is working from their viewpoint. This change is hard, right? And it can be really difficult to implement. So we simplify the process wherever we can, and we incorporate that community buy-in. The changes you adopt tomorrow won't be the end, just like where we are today won't be the end. So we need to establish the ongoing monitoring process that really allows us to pivot, revise our processes as information changes or initial outcomes aren't what we expected. I think we have some time real quickly to go through what's next. So I think we've mentioned a couple different times that we will have a dedicated session around coordinated entry data and prioritization. This came up as a need during the foundational session that we did with you all, feels like several weeks ago now, but I think it was just last month. And we mentioned then that we could do an entire session on coordinated entry and equity, and we are going to do that. Our biggest point is to really interrogate our system, not just by who is accessing coordinated entry, but also who is not. Are there barriers or lack of supports for specific groups in accessing coordinated entry? And then once we look at who is accessing and who is not, also then how our system is serving those people who are accessing it. So who's on our prioritization list, who's being referred, who's being housed, who's falling out, who's returning or being assessed multiple times, how long is it taking at each one of those stages along the way, and making sure that we can disaggregate that information by race, ethnicity, gender, age, household type, disabling condition, like all of those different pieces of identity, as well as the intersectionality between and among those various identities. So Black female-headed households with children, just looking for those disparities within our system. I think we have one last slide up. Yeah, I'm gonna kick it over to Mary.
Yep, and I've already dropped it in the chat. So do join us. The poll is active, and I see a number of folks have already started dropping in how you're feeling. Again, this will be packaged up with the information, and we're going to make some room for a little Q&A as you finish voting.
What are the words that are coming in, Mary? I can't see them.
So it's actually going to create a word cloud. Some folks are feeling a little overwhelmed because data does that to me. That would be my word for today too. But I see empowered, I see blessed, interested, tired, content, energized, happy, encouraged, attentive, great, excited, looking ahead with hope, comfortable, more informed, alert, hopeful, chill. I like the chill vibe. All right. We've got just a little bit time left. There's a bunch of resources that are going to go out to you after the recording is finalized and firmed up. Thank you for listening to us today. We do have some time for some questions and answers.
Thank you, Mary Frances, and thank you, Alyssa, for that session today on data. We haven't received any questions yet, so I'm going to fill the time with some next steps that we have as well. So as Alyssa and Mary Frances both mentioned, I think in passing, this is the beginning of a conversation we want to keep alive. So we have planned, and you can see by the graphic here, to do large group training like this. There was nearly 200 of you here today getting information on racial equity and the use of data. We are going to send out a survey after this session with the recording and with the materials that you can use at your leisure in your community. And we're going to ask you in that survey, would you like to come to a small group? We're calling the next series of sessions Racial Equity Data in Action. We really want to take it from the theories and the concepts that both Alyssa and Mary Frances presented today and take it into movement, take it into action. So if you have desire in your community and you want to be part of a small group, we're going to pull together a workshop that will allow us to walk through. We'll use the data racial equity dashboard that we provided mid-session as really our guiding. We'll talk about how to interpret and interrogate that data and keep going. When we complete that work, we have another thing that is one-on-one TA or the development of products that come out of this work. So we have the ability to take a large group to a small group, and then even a small group of that to take you as far as you want to go. So if you're one of those folks that in the word cloud was very energized or ready for the next step, we are ready for the next step too. So look for that survey, respond to it specifically if you want to be considered for the small group workshops, because that's how we're going to fill up those small group workshops. Okay. We have a question here that I'd like to kind of pose as well. And it asks, do you have any concrete examples of equity goals that have already been developed? And I'm not sure where this should be pointed, Mary Frances or Alyssa, so I'm just going to sit back and see who jumps on it.
I will try. I'm not known for brevity when talking about equity, but so there were a number of communities that participated. There were SPARK participating communities, which is supporting partnerships for anti-racist communities. One of those communities was Pierce County, also known as Tacoma, Washington. So to answer your question directly, there are a series of recommendations for each of those communities within the SPARK reports. Those are publicly available SPARK reports. However, that happened, a few years ago, and I did have an opportunity to work with Pierce County in this past year, and I got to see their recommendations actualized into goals. They were able to add an additional coordinated entry access point in a community that was experiencing disparities because they recognized that folks weren't coming to the front door. They weren't coming to those existing coordinated entry access points because it was so far removed from their community. So in Pierce County, they actually took a legacy traditional homeless services provider and they partnered it with a faith-based organization, and they stood up a housing problem solving approach that was community-based and targeted towards Black or African-American families. They have since looked at all of their data. They found that people are experiencing more positive housing outcomes, but they're staying connected to a case manager for longer. So all of that to say, check out SPARK reports. There's some great recommendations that are pretty universally applicable to communities everywhere to get some of your wheel spinning around what those goals might look like for your community.
Thanks, Mary Frances. Alyssa, anything you'd add?
I don't have anything to add specifically related to that question. I was actually thinking about the race equity initiative and the different goals, but I think that Pierce County was part of that. So, but I'm also thinking through like Austin, Texas did a really intentional pivot from what they were using for their coordinated entry prioritization to what they're using today. And it was a community-driven, equity-focused process. And it was a long process, and that was intentional. Like they knew that they could not move with a sense of urgency, and really were intentional about that. So we have more information on that we could probably share during the coordinated entry session when we talk next about that. I'm also just really excited. Like I'm hoping that folks are interested in this racial equity data in action opportunities, just thinking through like we did at a really high level, what the trends are and what we see in the Stella P data for California COCs, but would love to have the opportunity to actually talk with communities about that, really dig into your Stella P data, interrogate it. And then that is really a great starting point to understand what you don't have in Stella P and really where you could get it at the local level. So really excited for those opportunities. That's my shameless plug.
Thanks, Alyssa. And again, thank you, Alyssa and Mary Frances, both for today's session. We're going to go ahead and end a little bit early, but I'm going to again reiterate a few things about this. So you'll be receiving a survey with the recording and with the materials for today's session via email post, probably around Monday. And again, if you want to go from the large group training today into a small group workshop, please let us know. We want to get anyone who is interested in doing hands-on, doing in-action work on data and racial equity. As you see, the kind of large group, small group to one-on-one technical assistance, this is not just for racial equity and data. We're going to do another large group training. It was mentioned by Alyssa and Mary Frances both on racial equity. On racial equity and coordinated entry. We'll do the same thing, a large group training, folks who want to turn it into action, and then ultimately anyone who can take that action into actual implementation. And we have several more of these series coming up in 2022. Those are the ones we're going to attempt to accomplish this year. So I wanted to put those on your radar. To answer Nicole's question, how do we sign up for the small group? It'll be in the survey how to sign up for the small group. If anything ever doesn't work out, you can always just email me and I will stick my email in the chat here before we're done today. And seeing no more questions, I'm going to go ahead and give us a formal wrap now. And thank you all for attending today. Giving us your attention and your time and your energy is really, really an honor for us. Thank you, Alyssa. Thank you, Mary Frances, for your amazing presentation today. And thanks to Aaron and Marian and Helena, who did background stuff that not everyone saw, but it takes a team. So thank you for attending this California Housing and Community Development Training Session offered through the Emergency Solutions Grant Coronavirus Relief Consulting and Staffing Services Contract. This session and over a dozen other training sessions are and will be posted on the California HCD website so that you can view those at your leisure. Thanks, everyone. Have a great day.